Tell me about okay, you've been firefighter for how long now?
40 years, 40 plus years. I started as a volunteer when I was 16, went to work for the Woodlands when I just turned 20, and I retired when I was 60.
40 years, you've seen quite a few firefighters gone from basically the hazards of firefighting.
That is correct. It's not just the carcinogens that we deal with out in the field, it's the getting up 3 or 4 times in the middle of the night, it's the terrible sleep, it's the terrible eating habits, it's the psychological that works on you, PTSD. It's more than just cancer-causing agents out in the field. Even our bunker gear now we've been told that bunker gear causes cancer in firefighters because it has PFAS in it, which are forever chemicals that they use to make that bunker gear. So the cancer risk is number one, heart disease, diabetes, sleep apnea, all the things associated with getting up in the middle of the night is a problem.
Started the clinic here at Conroe and over at 290 for basically Houston firefighters and local firefighters. How many involved into this now?
Yes, we opened a Conroe clinic in September 11th, 2019. We started taking firefighters shortly thereafter with a couple of local departments. The word of mouth spread, and it grew from there. City of Houston put out a request for proposal. We responded to it, and interesting enough, we ended up getting the Houston Fire Department contract, which added about almost 4,000 firefighters to our roster. We opened up another clinic in Jersey Village to serve them. From that, we've been getting calls from people on the south side of Houston, on the west side of Houston, just all over the place. So we ended up thinking, let's build a mobile and bring it to the fire stations, and then that way they can stay in service, we can provide their physicals, and it's best for them. It's easier for us to move our staff to them than it is for their staff to move to us, and that's what we did.
Kind of run down the beginning, walk through from beginning to end, what all y'all do.
The mobile clinic, as in our regular clinics, we have 4 main functions that occur with the firefighter physical. They do a 12-lead EKG stress test, which measures your heart function and your endurance. We do a hearing, vision, pulmonary function, a physical fitness assessment where they use stretching, weights, planking to see how physically fit they are. Then we do an ultrasound from chin all the way down to testicles that looks for any lumps, bumps, nodules, cancer, an echo to do their heart. They look at their heart function, how much blood is pumping through their heart, is it the right amount, is their carotid arteries clean, everything associated with cardiovascular. Last, they meet with the nurse practitioner. They do a hands-on physical. They go over a 14-panel blood work of their body and go over their history, and from there, the nurse practitioner actually will give them what they call a prescription for health. We'll talk about how to remedy if they have anything going on, or if they're not in the greatest shape, how to correct that, and from there they're released. And then what's different about us is we will follow up with them. If they have something going on that they need help with, we will follow up with them and help them through that.
Blood work, everything else, how long does it usually take to get all that back?
The physical, the blood work takes a day to get back. It's no big deal. We draw it a couple days before, and then it's available for the nurse practitioner the day of their physical. Their physical lasts for about 3.5 hours.
So pretty thorough.
Very thorough. You don't get this physical. Everybody that's come through. I had a airline pilot that did this physical. He was also a Houston firefighter, and he goes, the FAA doesn't have anything on you guys as far as the physical, the thoroughness of the physical.
Now, since you've opened, you've found quite a few issues with several firefighters.
Correct. Cancers, diabetes, heart disease. We've actually sent a firefighter straight from our clinic to the hospital to get stented because he was having occlusions within his heart. So yes, we found, and then cancers, testicular cancer has been a big one, thyroid cancer. A number of people have been had to follow up and had dealt with those kind of cancers, but it was relatively small and able to be remedied.
just basically, just mostly this area you're going to keep it in, or are you going to plan on expanding some?
We're starting with the greater Houston area, and then we'll expand outwards from there. We do have a contract with Medina County coming up.
So I'm Troy Gutierrez. I'm the fire chief at South Montgomery County Fire Department. It's an honor to stand here today on behalf of our department and the McKenzie family. Corby unfortunately passed away due to occupational cancer a year ago in March. Huge loss. Corby, as some of these will attest, all of the department will attest, was a tremendous impact on the South Montgomery County Fire Department while he was there. He was someone to look up to, some that rookies would go to. He mentored people, and just a phenomenal guy. I'm so happy for Desi and Jerry for this expansion of their business. We were, as a department, we're one of the first to sign on and start getting our physicals done at their facility. And I will tell you that in our department, I don't have the count. Chief Johnson may be able to help me on this, but we have caught, I know more, 6, up almost 10. I think there's some others early, to where we have, as you see, one standing here that we caught early enough that got treatment, and he's with us today. So I know Corby is looking down in amazement right now and happy about this. And thank you all for honoring Corby in our department and in dedication to this, and congratulations.
Well, I'm honored to tell a little bitty quick story. If anybody knows me, it will be quick. I've been in it for 47 years. Everybody's waiting for me to go. They want me to retire.
Yeah, say
Okay?
that.
I have to tell you that. They want me to retire. I don't want to go as a monument in my fire department. South Montgomery County has had a program we were doing with in service fit for duty physicals prior to first response. And in my opinion, we were dealing with quacks. I don't like doctors. I like Jerry, I like Desi. I didn't care for what I was being told as I was getting older. I've been in a lot of stuff, all of us have, it's in the fire service. I didn't think I was gonna get a sucker punch. I'm a wide open kind of guy. I work as hard off duty as I do on duty. And I have a lot going on. Well, for 3 years in a row, my PSA level was elevated. And I didn't do nothing. Nothing. Told my wife, and I'm not gonna go to a doctor for a follow-up. And then we started using first response clinic. And because I had faith in the people that I was seeing, and belief that they weren't just blowing a bunch of stuff to me, when my PSA level in the 3rd year, I think it was, correct, was elevated up almost twice as what it was 2 years before that. I paid attention, and we had a gentleman that was, his name was a lieutenant in our fire department, Joel Stevens. We lost him to cancer. And Joel Stevens was in the same boat that I was at. Joel was a 30-year veteran out of the city of Houston, and I can't remember how many years we had him in South County, but quite a few years. And Joel was just like me. There's no way that word C is gonna get me. And Joel didn't do anything until it was too late. And it got him. Well, because Desi almost locked me in the closet and saying you're gonna go see somebody, I did a follow-up, and I found out I was stage 1 prostate cancer. The advantage I had in my story, it was localized, but the doctor, obviously I went and got a second opinion, and it just so happens I went to MD Anderson. My gosh, we got the best hospital in the country, and did a secondary opinion, and their comment was, if it was another year, I could have been in the stage 4. Stage 4 is not good when you got prostate cancer. Chances are getting it turned around is not good. And I didn't want to be what happened to Joel. I can tell you, I walk in my admin at my station headquarters, and I have a monument a cabinet that has Lieutenant Stevens. Every time I go by that cabinet, I could have been another one. All I can tell you, they're saving lives. They saved mine. They've saved others in our department. I can't even think of how many people they have affected and touched across in their business. But I'm standing here today because of that. This is approximately 3 years ago. As far as I know, I'm still in remission. I'm still honoring. I'm still working. No, I'm not going to retire yet. But the thanks to them. And I appreciate everything you're doing. I'm a firm believer in what the program is. I'm an advocate for anybody that thinks that they're just doing this to take our jobs away from us. Because that's kind of where a lot of us were thinking. This medical thing was just to take our jobs away from us. And kudos to the South Montgomery County Fire Department, because I'm gonna tell you, our department didn't turn face on us. I mean, they stood behind me 100% plus through this process. And I don't wish it on nobody. But I'm here today.
My name is Matt Capizzelli. I'm the district chief at Waller Harris ESD 200. Sorry. I'm kind of loud on my own. When I first went to first response, it was when I was with the Tomball Fire Department. They had signed up to do physicals yearly. Went in, did the normal physical. I never fought it. It was always important to me to be healthy. And I knew the importance of what it meant for everything else. Kind of like Chief Johnson was saying, Desi pulled me in, no fluff, no nothing. She just hit me with it. Said that the way your numbers are, you have diabetes. There's nothing else. That's what it is. I'm a second generation firefighter. Everybody in this room, probably, or outside here, knows my dad. He was with the city of Conroe. Bigger than me, but bigger personality than me as well. He did more for this county than many others, than I'll ever do. But he had diabetes. He ended up dying of congestive heart failure. And so when she hit me with that, it hit me. But luckily she stuck with me, gave me all the tools I needed, more than just medication, but nutritional help, nutritional backup, testosterone as well. Got me all my health back together. That was 4 years ago. Since then, I've lost over 120 pounds. Completely changed. It's completely changed everything for me. Being around all these guys who are looking at retirement. I still have 20 years left at least. And I know that because I have 20 years left before my son's going to be out of college, and I got to pay for that. So I have to have 20 years left. But I truly believe that, thanks to Desi, thanks to Jerry, that I'll be here for those 20 years plus. I'll be able to see them graduate college. I'll be able to see my grandkids. I'm truly thankful for everything they've given me. Like I said, I lost my dad way too early. If this were around when he was still here, I for sure he'd still be here. I know that for a fact because everything that was wrong with him was easily treated. Easy to fix, and it could have been done because I've done it. And he was better than me on every aspect, so I know he would have done it tenfold. So, anything I can ever do to support this in any way possible, I'll be here for it because it's definitely changed my life, and I know it will for everybody else.
Thank you, Desi, Jerry. I'm honored to be here. I appreciate everything that you do for firefighters and Houston firefighters. The biggest challenge for firefighters is actually, like someone said earlier, is wanting to go to the doctor. We don't want to ever hear bad news. We see bad things, but we don't want to get the bad news. And one thing that First Response Family Clinic and their staff does very well is that they make you feel like you're at the firehouse. And that's a big piece of medicine when it comes to firefighters. Because when myself and Luke Mannion that sits in the Health and Safety Committee for Houston, we started filing cancer claims back in the early 2000s. when it became law. And every single firefighter, we noticed that that was their medicine was trying to get back on the job, right? They wanted to get on the job so they could forget when they got the diagnosis. They said that was a good treatment for them, but they didn't want it. A lot of them waited, and there wasn't this available for them back then. It just wasn't there, and it took their vision of y'all too, and bringing that staff to make it happen. So I want to tell you a little bit about its purpose, right? This will give firefighters an opportunity to receive NFPA 1582 physicals across the state. Its purpose is to ensure the health and safety of firefighters by identifying potential medical conditions that could impede their ability to perform their duties. In July of 2022, the International Agency for Cancer Research reclassified occupational exposure as a carcinogen. Carcinogenic to humans. So they rated firefighting as a group 1 in July of 2022. Before July 2022, it was a group 2, which meant it was possible to human lives. Making a significant shift in their assessment of link between firefighting and cancers. Firefighters have a higher risk of being diagnosed with cancer compared to the general population. Since 2002, the IFF has attributed more than 60% of its firefighters' LOUD to cancer more than any other cause. So, thanks again to Jerry and Desi, Brittner, and your staff for seeing the need and feeling the need.
Good morning. My name's Leonard McCusker. I'm Fire Chief with ESD3, and I'm also the President of Montgomery County Fire Chiefs Association. The Fire Chiefs Association, we represent 10 ESD fire departments in the county, and also the City of Conroe and the Woodlands Fire Department. And we do have some associate members, the Hospital District, Fire Marshal's Office, Sheriff's Office, Office of Emergency Management, and Texas Forest Service. Desi and Jerry Bittner, who I've had the pleasure of knowing for over 20 years, have become absolute advocates for first responders and wellness and health. It's become their new life mission to make as many first responders healthy and well as possible. First Response Clinic and staff take a personal interest in your overall well-being. In First Response Clinic, their goal is to help educate first responders on proper nutrition and health. They provide critical health screening for importance of early detection of hypertension, obesity, diabetes, heart conditions, and cancers, to name a few. Just in our department alone, they've alerted us to several of our members about health and wellness issues that they were unaware of. And y'all been doing our screenings for 3 or 4 years, and they do an excellent job, and they truly care about each individual. I can tell you, nobody wants to hear their doctor be the bearer of bad news about a health issue that they may have. This is why it is critically important to get annual health screenings and wellness screenings for early detection of potential issues. We owe it to our families and ourselves. Early detection and education are key, especially for first responders who are exposed to hundreds of unhealthy diseases and atmospheres through our career. The new mobile clinic was a brilliant idea. We'll be able to reach more first responders than ever was thought possible. There should be no excuse for any first responder in the Houston area not to be screened. The cost is very affordable and gives our members an added benefit with peace of mind knowing their status of the health. I'd like to thank First Responder Clinic for allowing me to be part of today's dedication ceremony. But most important, I would like to thank Desi and Jerry and all the staff at First Response Clinic for caring, compassion, and commitment to first responder health and well-being. You folks are truly making a difference.
This is the gentleman that hired me in the fire service. I was just turned 20, and he took a chance on me, and I just thank him. I pray gratitude all the time for Chief Dawson.
Wait. Jerry McGann was my battalion chief when I was with the Woodlands. I'm sure they're going to talk about his personality. He very much should be here, but again, like I had mentioned, the traumas of the fire service took him prematurely. His room is the nurse practitioner room. I wanted him in my room to be able to talk to the firemen, to make sure that they're mentally healthy. It was just maybe 2 weeks ago that we caught another firefighter that was extremely suicidal, and we sent him up to the Center of Excellence in Maryland. He's part of a union, and he is, thanks to the union, up in Maryland in a 30-day inpatient treatment, getting the help that he needs at no cost. Part of our foundation also provides airfare if he doesn't have the funds. We will pay for that. We are 100% bought into the fire service to prevent premature deaths such as suicide.
Jerry McGann, I guess, what could you, if you didn't know him, you should have, because he was really a unique individual. And I want to thank the family and everybody here for this event, to be able to recognize Jerry in such a wonderful event. He was a great guy. I knew Jerry. It's going to be as hard as it was for me during his funeral, but it's I'll try to get to it. He was a unique individual. If you didn't know Jerry, he loved kidding around. He could look at he'd come out to our place out on the ranch, and he'd look at a tree stump, and he'd say, I want that tree stump because I can make something out of that. I can make something, and he would take that tree stump and he would make something beautiful out of it. Just the way he was, very creative. I knew Jerry when he was in high school, and he came to the Woodlands Fire Department right after high school, and we hired him on, and it was a great day. And I also hired Jerry Bittner, so don't blame me for that. Okay? I thought Jerry was a good hire. And besides that, we were starting a softball team, and we needed softball players. So we recruited our fire department on softball players, and some of them are here today. Jerry was one of them. Jerry Bittner and Jerry McGann both were softball players. And Wayne Walker, who you're going to hear about, was another one who I can say he could stand from center field and throw a line drive all the way to home plate and never bounce that ball at all. He was such an extraordinary guy. You'll hear more about that. So Jerry was definitely an influence. He was my brother from another mother, who we used to call. He had tattoos, firefighter tattoos on him, and one of the tattoos represented me, which I thought was very encouraging. Anyway, we'll get through this. Anyway, as Jerry would have been here, I think if he had had an opportunity to see and to know some of the possibility of getting help early on. And Jerry, basically succumbed to his demons back in 2017, and was a real loss to not only everybody in the fire service, but to his family. He believed in his family, his friends, and his fire department family more than anybody I knew. And we would sit down and talk, and he wouldn't drink beer. I would, and he would drink these Harvey Wallbangers. He loved Harvey Wallbangers. And we would sit there and talk for days, not days, but hours, really. It seemed like days sometimes. We'd talk and talk about old times, talk about what we were doing, how we were going forward. And I think that Jerry would certainly be here, and if he had had an opportunity like Dizzy and Jerry said, an opportunity to be able to be diagnosed with PTSD early on in his career and be able to get the help that he needed. I really believe Jerry was here. And I want to thank everybody that sponsored this trailer and everybody, and Dizzy and Jerry for thinking about the idea of how important it is for firefighters to get the help that they need. And to be able to be here and to see it in action, to see it in motion, and see it further in the future is just tremendous. And I want to thank y'all for being here, and I want to thank them for being able to get it all together and being able to present it. Thank you.
Good morning. My name is Mohammed Kuchak, Assistant Chief, Houston Fire Department. Firemen in general prioritize the lives of others over themselves. And it's inculcated in our academies, it's taught in the culture. The unfortunate thing about that is that firemen often set aside their own health, their own wellness. And I would posit that that's necessary. It's necessary because you don't have the time to think out some of those responses, not in the moment, not when you're needed. And it warms me, it moves me to see people caring about my firefighters the same way I do. In 2024, the Houston Fire Department, for the first time, entered into a wellness program with First, but with anyone. And in that year, we found over 1,000 serious medical conditions. Some so serious as thyroid and prostate cancer, and we were able to take care of our members early before it got serious. It's particularly moving when I see other people like Gabe and like Chief Marino stepping up, like Jerry. So, on behalf of the Houston Fire Department, on Fire Chief Tom Munoz and the Mayor, we're very grateful for everything that's been done and will be done in the future. Thank you.
In addition to owning a business, I also got to work with Alan at the fire department, the city of Conroe Fire Department. And he went to work there, I think, after I did, I think sometime in 93 or 94, I couldn't remember the exact date. But he was a good friend, he was a fisherman. I was talking to Jimmy, I don't know if he's still out here. But when you wade fished with Alan, you had to be careful where you went, because he was like 6'4". And if you got too far into the water, you're like up to here. And of course, keeps on wading. So he was a good guy. If you never met him, he was a good friend. He retired in 2014, and shortly after that, he did pass away in 2021, and we do miss him. He was for our company, he was a big proponent of industrial apparatus, helped get that business off the ground, and it's today is still down there in Lamarck, Texas, where all up and down, if you see any big refinery truck up and down the ship channel, Alan probably designed it. And when they were doing this trailer, I asked Desi the other day, I said, hey, what room are y'all gonna name Alan after? Because those that knew Alan knew he couldn't hear anything. He was like, he was deaf. And it's like, so every time like this, luckily for us in the city, I know Montgomery County is just now getting around doing the physicals. In the city of Conroe, when I went to work there, and even today, you did your physical every year. And so we go into that room, and it wasn't a well-built trailer like this one, it was real flimsy. So you'd be in there, you'd hear the people outside talking, you couldn't hear that little beep. So Alan just kind of made a joke out of pushing that little button, like doing Morse code, just to see if he'd get a rise out of those people in there. And occasionally he would. Some of them didn't take it so well, but you know, it's important for, you know, I don't know if doing the physical after Alan retired would have saved his life. You know, God only knows, right? But it couldn't hurt. And you know, we'll miss him. I think what First Response is doing is a big deal. Hopefully we're going to see these running all up and down the coast, you know, helping people like myself that, you know, I luckily, you know, from the city, go get my physical every year. So, and that, you know, I got that from the city. So luckily, you know, I know they're doing it for the city of Houston now, and hopefully they'll do it for all the fire departments in Montgomery County, and maybe stretch out from there and do other fire departments across the state. And if y'all need anything, Desi and Jerry, for Pat and I or Bill's Bush family, just let us know. We're here to help.